this is Elena and welcome back to this channel. So today we are going to talk about a very interesting antibiotic, but before anything else, just a disclaimer guys, this is not a medical advice, and if you are seeking for a medical advice, please consult your doctor. Alright, so today we are going to talk about azithromycin. Now, what are the basic information that we need to understand or to know about azithromycin? So, this drug is categorized under macrolide antibiotics together with erythromycin and clarithromycin, and we also have telithromycin, etc. Now, what's it used for? Anong gamit ng ating azithromycin? So, it is usually prescribed by the doctor for cases of sexually transmitted chlamydia, community-acquired pneumonia, for whooping cough, for tonsillitis or bronchitis, urethritis that are caused by Chlamydia trachomatis, and Moraxella avium, etc. Alright, now, what are the available dosage forms of our azithromycin? So it is available in an IV formulation. Next is a suspension with a dosage strength of 100 milligrams to 200 milligrams per 5 ml, and it can also be available as an oral tablet with a dosage strength of 500 milligrams to 1 gram. Okay, so usually for outpatient adult doses, the regimen starts from 500 milligrams once a day for 2 to 5 days, depending on your case or depending on the severity of your infections. And for cases of chlamydia, it is usually prescribed by the doctor 1 gram for 2 to 5 days, again depending on your case. Alright, so now as a pharmacist, we are obliged, or it is our role, to provide the appropriate drug information to our patients in accordance to the specific medications that are prescribed to them by the doctor. Now, what are the things that we need to do as a pharmacist, or what are the things that we need to share to our patients as a pharmacist? Okay, first is, number 1, you have to ask the patients for cases of previous allergic reactions that are associated with the use of other macrolide antibiotics. So pwede nating tanongin yung pasyente natin, ma'am, dati ka bang nag-take ng erythromycin or clarithromycin, and meron ka bang naranasan na allergic reactions? Pag sinabi niyang wala, walang problema. Okay? And also pala, these interviews or questions are also asked by the doctors una pa lang. Okay? So, if sinabi niyang wala, pero after taking azithromycin, if he or she develops swelling of the face, swelling of the lips and the tongues, nagkaroon siya ng rashes, and even difficulty of breathing, you have to tell your patient to immediately seek for the medical advice. And I know naman, and surely your doctor will shift you to the appropriate or other antibiotics that is best for you. Alright? Second is, do not take antacids that contains aluminum or magnesium within 2 hours before or after you take azithromycin. Why? Because antacids or aluminum containing drugs, or aluminum and magnesium containing drugs, can decrease the absorption of azithromycin. That is why we always have to space out 2 hours. Alright? And third reminder is, it can cause GI disturbances. Actually, it is one of the most common side effect naman to all kinds of antibiotics. Pwede siyang mag-promote ng GI disturbances. So, it can cause the patient diarrhea, nausea and vomiting, and even stomach pain. So, masakit din siya sa tiyan. Alright? And then, fourth is, you can take azithromycin with or without food, or as prescribed by your doctor. Right? And then number 5 is macrolides, which includes azithromycin, may prolong the QTC interval and should be used with caution in those patients that are under pro-arrhythmic agents. Now, what is the QTC interval? Yung QTC interval natin, it is the interval of our heart waves, or siya yung nag-identify ng heart rhythm natin. That is why azithromycin is only given to patients if they have a valid prescriptions. And the next reminder is avoid exposure to sunlight. Why? Again, because it can promote sunburn easily. So for cases na you will do any activities outdoors, you have to wear protective clothing, or you can also use sunscreen. So sabi ko nga doon, 'di ba? Pwede kayong gumamit ng umbrella, yung mga long sleeves ninyo, or yung mga pants, ganyan. Alright? Next is, it is not used in pregnant patients, especially if they are in their first trimester. And it is used with caution in second and third trimesters of pregnancy. Alright? And the last but not the least is you have to complete your regimen. Now, one of the best things about azithromycin is that it is used single dose only. O kumbaga, once a day only for 2 to 5 days. So, hindi siya nakakatamad inumin. Kasi once a day lang naman, diba? Kumpara doon sa mga gamot na tinitik natin 3 times a day for 7 days. So, ang tagal-tagal, tas ang dami-dami man nainom. Pero itong azithromycin kasi, once daily use lang or as prescribed by doctor. Pero kadalasan once a day, especially for adult doses. Alright? So, that's it for today. And if your symptoms persist, always consult your doctor. Amen. So, yeah, that would be all. Thank you for watching.